Well, thank you everyone for joining us. I'm really excited about the conversation we're going to have today. I am thrilled to have my friends Kelly and Marit here. We have a packed agenda for you, so we're going to get right into it. And if you have any questions throughout the session, please feel free to put them in the Q&A, or we can turn on your mic at the end and you're welcome to ask, but you don't have to wait to submit questions if you have them. All right. So for our agenda today, first, Kelly's going to do some background on Drug Utilization Review Board meetings and their importance. And then we're going to hear from Marit about her personal experience testifying. Just so everyone is aware, Marit is the mom of a son. His name is Brecken. He's turning 10 in February. He's doing great. I'll let her tell more about him, but I think that she's has a pretty good perspective. And then I'm going to wrap it up with how you can get involved with these meetings and help us. And then if you have any questions, we'll be happy to answer them at the end. And with that, I will turn it over to Kelly.
Hi, Lauren. Thanks, everyone. Thanks for joining us today. So I'm going to talk broadly about what drug utilization review is and why it's important to us in the Duchenne community. As you can see, drug utilization reviews, DUR stands for Drug Utilization Review. There's also another body, that Medicaid body and process that's important to us in the Duchenne community. They tend to operate the same way, so I won't go into a bunch of detail about it because honestly, it's confusing, like a lot of things Medicaid. So I'm going to read you the definition of DUR, the official definition, because they have quite a few responsibilities. So DUR is a two-phase process consisting of prospective and retrospective screening and monitoring of prescription drug claims to identify potential fraud, misuse, or medically unnecessary care, and to implement corrective action as needed. DUR programs must be conducted in accordance with Section 1927G of the Social Security Act. So that's the official description of what they are and how they're regulated. Now, there are some, so we have a saying in this work that we do that when you've met one Medicaid state, you've met one Medicaid state. If you've met one health plan, you've met one health plan. However, there are some consistencies among all states that they're required to meet under CMS, which is the Center for Medicaid and Medicare Services. Beyond that, though, CMS gives states a lot of latitude as to how they run their DUR meetings. And so, and Marit will go into a little bit more about that, but there are some requirements like signing up to speak, doing conflicts of interest checks, that sort of thing. Basically, what this means for the Duchenne community is this is the mechanism for which every state Medicaid program reviews our newly approved treatments by the FDA. And what they do is they will basically, these boards are made up of mostly physicians and pharmacists. That there's some, special rules. In some states, the Medicaid director or the governor can appoint additional members to those boards. But what they do is they receive the clinical trial package from the FDA that the FDA used to approve a treatment, and they present it to their board members, and they basically decide and vote on what kind of criteria they're going to put in place for prior authorization. And so why is this important to us? Well, you all know that the clinical trial package doesn't necessarily tell the whole story about what it's like to live with Duchenne and what kind of treatment effect we're seeing in the real world with these treatments. And so that is critically important for patients and caregivers to speak at these meetings and let people know they do not have a deep bench on any rare disease treatments, especially Duchenne. And so that expertise and that specialization of quality of life with Duchenne really has to come from the Duchenne community. So what we like to do is we like to have a patient or a caregiver speak during these meetings. We really like to have patients who have are on the treatment that they're reviewing. And then we also like to have one of our Duchenne specialists, hopefully, if we're capable of finding one in that particular state, we like to have them sign up and speak on the on Duchenne and what the data means. So if anybody has any questions about that, anything I've said, or wants more information, go ahead and drop it in the chat. But that's just a high-level overview of DUR. I will also add that many of them have meeting schedules that are listed on their state Medicaid websites. Those tend to happen quarterly or sometimes every couple of months. They don't all have the same meeting schedule. And what we've seen so far is we've had surprisingly really good Medicaid coverage for ELEVIDYS so far, which, you know, we've been over here at LHF, we've been doing this since 2016, since EXONDYS was approved. And so, and for the community's awareness, we cover every one of these, every DUR meeting and P&T meeting that reviews any Duchenne specific drug. We cover them in partnership with PPMD. So Brian Dender and a member of our staff will cover them in tandem. And then, but we've, like I said, we've had really good coverage. So we're just hoping and praying that that continues. So I will turn it over to Marit.
Good afternoon, everyone. It's a pleasure to be here. As Lauren mentioned, my name is Marit Sivertson. I live in St. Paul, Minnesota with my husband and 3 boys. My oldest son, Brecken, has Duchenne and is in 4th grade. I have been involved in several of these Drug Utilization Review Board meetings as a parent advocate testifying. And so I thought I would go through just some tips and pearls for you if you want to get involved in these advocacy efforts and in testifying. So the logistics of presenting testimony, all the information pertaining to these meetings can be found on the state's Drug Utilization Review webpage. So this includes the public notice of the meeting, which outlines the agenda and which is required under state law. So you're going to want to navigate over to that website and pull a copy of that public notice. Pre-registration for all of these meetings is required to provide public comments. So make sure that you are aware of the deadline to do that. Oftentimes, if you do miss that deadline, they're not going to allow you to provide public comments. So make sure you are aware of that. As part of the process of registering, every single state is going to require that you complete a conflict of interest form and submit it to the state so they have that on file. Most of us have no conflicts of interest, so it's not really applicable to us. You'll just check the box if that's the case that you don't have any, and then submit the form. If you have any questions on how to fill out that form, you can always reach out to Lauren at PPMD or Kelly or myself, and we're happy to have you, happy to provide some guidance on filling that out. At the time that you register, you want to make sure that you are asking how many minutes you're going to be allotted to speak. They will hold you to this time frame. I've been in several of these meetings where they are cutting members of the public off because they go over the time that has been allotted to them. I would say on average, you're looking at about 3 minutes to provide your testimony. So that's a very short period of time to get your point across. So for this reason, I highly recommend that you write your testimony ahead of time and practice it out loud several times to ensure that you stay within the time frame that you are allotted. This really isn't the forum to speak off the cuff because of this time frame that's in place. You're also going to want to inquire from the person in charge whether you're going to be on camera via Zoom or if it's a dial-in option only. Some states also only allow written testimony versus oral testimony. So you want to figure out what the game plan is ahead of time to help you feel more comfortable come the day of. If you're going to be on camera, I would recommend business casual attire. There's no need to be any more formal than that. Be prepared for day of glitches. I was scheduled to testify in Illinois with another Duchenne father, and the Zoom link that they sent us was not allowing any members of the public in. So we had to call the agency, pivot, and try and track down a call-in number so we could provide our testimony, which we were able to do. But you really have to be open-minded and go with the flow, because this is a state agency. There's a lot of players involved, and there may be some day of glitches and logistics that need to be worked out. So have that when you're looking at the agenda. They usually have a helpline number. Make sure that you have that accessible in case you need to call. And all of this, of course, is, as I said before, really going to make you feel more comfortable when you're providing your testimony. So moving on, I'd like to go into the components of your testimony. As parents, we have an incredibly powerful story to tell. And both the perspective of the parents who are waiting for their child to receive the treatment or therapy, and the parents whose children are on therapy, who've been involved in the clinical trials, in my opinion, are equally as important. So the members of the committee need and want to hear from us. And we all have to remember that they are parents, grandparents, aunts, uncles, and brothers and sisters too. They're just like us. So, feel comfortable when you are giving your testimony. An outline that I have followed with the remarks that I have prepared really starts with thanking the review board for an opportunity to provide the testimony, and introducing yourself and your family, right? Stating how old your child or children are who have Duchenne, and then pivoting into a story or two describing what I like to do is I have a couple stories. My son Brecken was involved in the SRP 9001 clinical trial. And so I like to include a few pearls outlining and really painting the picture for members of why full coverage is so important to our community, and what it's meant for my son, and what it'll mean for all the other boys within our community living with Duchenne. If you are a parent who's waiting for your child to access the therapy, really describe what it would mean for you and your family if your child receives the therapy. Describe what these benefits mean in detail. And then at the end, you want to make sure that you always close with the ask. And by the ask in this situation, that means requesting that they cover the therapy pursuant to the FDA label with as few barriers as possible and as quickly as possible. So that's the general outline that I follow with the remarks that I prepare ahead of time. And Lauren, I'm happy to answer any questions that folks have.
Great. Thank you so much. I'm sure we'll have questions at the end. And if anyone has any right now for either of those two lovely ladies, please feel free to put them in the chat. So that was a lot of really good information. And I think it's pretty obvious that these DUR meetings are very important right now, especially with Elevidys recently being getting FDA approval, and then all of the other treatments that are coming down the pipeline at the FDA. We're really going to need patient voices at these DUR meetings. And so with that, I want to say that if any of you are interested in helping us, like Marit mentioned, testify or share your perspective, you can submit written comments. We can have you talk. I always say there's no small way to help. You can shoot me an email at Lauren at PPMD. This is my email. You can shoot me an email and just let me know what state you live in if you're interested too, because we're tracking the different states and when their meetings are. And we would love to get folks to be able to talk at these meetings who live in those states. And like Marit said, it's really important that they hear from parents and the folks who are directly impacted by the decisions that are being made. And with that, I think we can get into if anyone has any questions. I have a quick question for Marit, if she's willing to answer. Was it, when you testified, was it nerve-wracking? Were you stressed? Like, was it what was your experience like? Did you feel, was the committee not kind to you, or did they have any questions? Did you just get on, testify and then log off? Like, how did it go actually on the day of for you, your nerves, the experience, and then after?
Sure. So, I think that nerves are to be expected. It's a natural response in these situations, especially if you're not used to public speaking, or if you haven't testified, in a public forum before. So just know that that's very common. But you come across very genuine too when you feel those feelings. And so, I think that, again, reminding yourself that these are human beings too. These are parents, these are grandparents. And they really want to hear from us, hear our perspective. They welcome it. That will help alleviate some concerns. The first DUR meeting that I testified in, I actually had a member of the committee was visibly moved, by the story, and indicated that it's really important for members of our community to continue telling our story broadly and widely. So I think that is a testament to the power of us, using our voices and telling our stories here.
Yeah, that's really interesting. And I will also add that if anyone wants to testify or is selected to testify and you're nervous, I know I'm more than happy to help you practice. If you want that, sometimes I think just getting the words out and saying it a few times makes me less nervous when I'm public speaking. So that can be helpful. And we're willing, I know Kelly and I are willing to help you with that, and Brian on our team, we would love to, and Amy at Little Hercules.
Lauren, can I add something to that?
Oh yeah, of course, Kelly, go ahead.
My apologies, my internet is behaving so badly. I want to sort of dovetail on what Marit said. This process was originally set up as it is in order for manufacturers to give information on the data package and answer questions about the data package that the committee members may have. It really was not initially set up for patients.
Did you guys lose Kelly too?
Yeah, and I can jump in here too until Kelly comes back online. I think where she was going with this is that there are going to be members, from industry who are also providing public comment, but it's a totally different perspective than what we're able to provide as parents. So, I think it's critically important that our voice is heard during these meetings.
I completely agree. And I mean, here at PPMD, I know at Little Hercules, we are very much like, listen to the patients, listen to the parents. So I'm with you there. The next question I actually have is for Kelly. So hopefully she can join. But how many DUR meetings have you spoken at, Marit?
I've had 2, so Utah and Illinois, and then there's some coming up here.
And were they both successful? Did they vote on it that day? How did it go after you spoke?
Yeah, so these are very long meetings. I think the first one was about 4 hours. The second one, I think, lasted maybe 5 hours or longer. Oftentimes, there is more than one therapy or treatment that is being reviewed on the agenda. So the length of these meetings really depends on how many reviews they are doing. And usually the vote is at the end. So if you don't, I understand that, we're working parents, or we're home with the kids and our time is valuable. So If you don't have time to stay on to the very end to hear the vote, that's okay. PPMD or Kelly and her team can certainly send a note after you provide your testimony, letting you know how it turned out. In Utah, they provided full coverage per the label. And in Illinois, they are waiting. They're going to do a case-by-case review, and they're going to wait to make a coverage determination until the most recent data is released and reviewed by the FDA for Elevidys.
Oh, great. Thank you. And Kelly came back just in time for me to ask her a question. Kelly, are you back with us?
Can you hear me?
Yeah.
Okay, go ahead.
No, don't worry about it. I have a question for you. So we know that these meetings are crucial for Medicaid coverage in states of treatments, but do you think the decision made at these meetings has any impact on private insurers like downstream? Do you think it makes a case for private insurers in that state? I'm just interested in how this might impact people how this impacts the whole system, not just the Medicaid. Do you have any takes on that?
I do. And Lauren, that's a great question. So the short answer is no, because Medicaid has a requirement. So there's something called the MDRP, which is the Medicaid Drug Rebate Program. And CMS dictates that if a manufacturer participates in the MDRP, that manufacturer has to give the Medicaid program a discount on the price of the treatment. In return, Medicaid has to guarantee access in exchange. So with Medicaid, we see much stronger patient access tools that we can use to get coverage. And then there's an appeal process, and we can go to fair hearing for an individual patient. But we don't have that in private health insurance like we do Medicaid. So that's a critical, important difference there.
Okay. Thank you. I know sometimes the nuances between the two of them. I work in this field and sometimes I get confused. So thank you for the clarification.
Now there is a correlation between Medicare and private health insurance, which is a little bit different, but we don't see that so much in Medicaid because they're administered by the states.
Okay. No, that makes sense. I think that is it for questions. Kelly, or Marit, do you think there's anything we missed that's important to get across before we log off? Or you guys have been great, and this has been really informative, and I'm hoping a lot of folks are going to want to help us out with these meetings moving forward, but I just want to give you guys the chance to say any last words if you have any before we get off.
Just that I'll just reiterate how important it is to make your voice heard where decisions are being made that impact us on a daily basis. And I cannot overstate that enough. I think patients see that happening around them all the time. And it's frustrating because you can tell by the feedback that they give that they just do not understand what it's like to, not only what it's like to live with Duchenne or care for a loved one with Duchenne, but that I always say the patient voice fills in where the data package has gray areas. I'll give an example. The NSAA data from Elevidys, we're seeing that a lot of payers don't understand it. Why don't they understand it? Because the NSAA is a Duchenne specific outcome measurement. And so if you don't understand Duchenne, you don't understand the NSAA. So that's where the education piece from the community really plays a critical, important role. And so, it is very, very important. And like Marit said, we have seen the community change policies during these meetings. So it is powerful and it is important.
Yeah, I completely agree with everything you said, Kelly, and I think it's crucial that we get more folks and parents and patients involved in this process, because these decisions impact the people in our community. And I think we should be absolutely more involved and sharing what we think at the very least. So here's my email again. If anyone wants to help get involved, I would love to help guide you through that process. We can't do this work without the parents like you guys who are willing to help us and testify and do all those things and submit comments. So we're really grateful, and I'm happy if you have any questions or want to talk about your state specifically, I'm happy to chat with you to talk about anything. You can shoot me an email. And with that, I think we can be done. Thank you again to you both for joining us. I think this was really informative.
Thank you. Thanks everyone for joining us.
Thank you for having me.